The question is to the Minister of Health. This morning, the Public Accounts Committee heard from flight paramedic Trevor Kidd. Mr. Kidd traveled from Thunder Bay to tell us what it was like as a frontline flight paramedic to provide service within Orange Air while millions of tax dollars were being wasted and while patients were being put at risk. Here's what he said when asked why more of his colleagues are not willing to come forward to tell us about their experience. He said they're afraid to lose their jobs. Speaker, these are our frontline emergency responders of our air ambulance service. I ask the Minister this: why should those frontline emergency responders have to be afraid to tell us about their working conditions in this province? I would ask the Minister to respond directly to Mr. Kidd and his colleagues on the front lines.
Minister of Health.
Thank you, Speaker. We think it's very important that we have a full airing of what is happening or what was happening at Orange, Speaker, and that's why Public Accounts is meeting and will continue to meet to hear from people like Mr. Kidd. Speaker, I, of course, am paying attention to the hearings. I think it's important that we do continue to improve operations at Orange. That's why we have Bill 50 before this House, Speaker. Bill 50 includes whistleblower protection, Speaker. I really wish that if the member opposite was genuinely interested in improving the operations at Orange, that he would quit blocking Bill 50, Speaker, and support it.
Sir, thank you. Supplementary.
Speaker, when we raise questions in this House about what's going on at Orange and why ambulance services cannot respond to emergencies because there are no pilots, because there are no paramedics, because of a faulty interior that doesn't allow paramedics to conduct basic CPR.
Member from Peterborough, come to order.
When we raise those issues, Speaker, the Minister accuses us of playing partisan politics. Mr. Kidd raised those same questions in the Public Accounts Committee today. He told us that little, if anything, has changed. I would like to know now. She accuses us of being partisan. What does she have to say to Mr. Kidd, who's listening to her now? Is he being partisan as well?
Speaker, I would like to say to Mr. Kidd and to all the witnesses who have come to testify before Public Accounts Committee, thank you. We think it's important that we have a full airing of the issues around Orange, Speaker. I think it's also important to note that the committee does provide protection, Speaker. I would urge the member opposite to stop suggesting otherwise. The witnesses before the committee do have protection, Speaker. I also would invite the member opposite to reveal the information that he has, because I don't know why he's hiding information, Speaker, when he has no compunction whatsoever in releasing personal health information.
Final supplementary.
Well, one of the reasons, Speaker, that we have the information is that the people out there trust us and they don't trust this government. That's why. They don't trust this government to take them seriously. And that's why those paramedics on the front lines continue to try to find a way to get the message through to this government that they continue to experience downstaffing, that there continue to be circumstances where there are no pilots, where there are not enough paramedics, and where they cannot respond to emergency calls. Now, the minister won't listen to us. She continues to say that everything's fine on the front lines. Will she tell Mr. Trevor Kidd and the paramedics on the front lines today that she will now begin to take some decisive action and restore credibility to our air ambulance service?
Minister.
Speaker, my understanding is that Mr. Kidd did leave Orange in 2009. I can also tell the member opposite that I have met with several current frontline staff at Orange, Speaker. They tell me that they are very encouraged by the changes they are seeing. I've said in this House before, Speaker, that the new leadership at Orange is very committed to getting the staffing where it needs to be, Speaker. They're making great progress, and I look forward to hearing from them very soon about the progress they're making in their staffing.
Thank you. New question, the member for Newmarket Aurora.
Flight paramedic Trevor Kidd. Back to the minister. He traveled here from Thunder Bay to testify at the hearings into this Orange Air Ambulance scandal. He told us why he no longer works there. And here's what he said about why the exodus of frontline paramedics and pilots continues today. I'll quote from his statement. Because they feel that the actions done so far have been to try to minimize political fallout and have little confidence that serious efforts are being made to improve patient care. When we raise these concerns in that tone, we're accused of being partisan. I would like the minister now to explain to Mr. Kidd why all of those people on the front lines still don't have confidence, and what will she do to restore that confidence?
Thank you. Minister of Health.
Speaker, I can tell you that we are very interested in hearing from all of the witnesses. This particular witness has not worked at Orange since 2009. Speaker, I can tell you that the paramedics I speak to are encouraged by the progress. I think it's also important to recognize, Speaker, the work that our frontline staff are doing rather than having them bashed every day in this legislature. Just yesterday,
Member for Chatham, Kent, Essex, come to order.
Were transported by Orange. 58 patients who are grateful for getting to the care they need. Speaker, 50 of those patients were being transferred from one facility to another. There were 7 that were transported by land. 7 babies, pediatric patients, were transported, and there was 1 rotor scene response, Speaker. This work is ongoing. We have to say thank you to our very dedicated frontline staff.
Thank you. Supplementary.
Well, Speaker, I'd like the minister to listen to these statistics, because they are statistics directly from Thunder Bay, just one base, over the last month. 29 recorded incidents of downtime, 17 due to no paramedic available for 87 hours, 10 due to no pilot available for a total of 90 hours, 2 incidents of unscheduled maintenance. Speaker, the minister can tell me about 50 patients who have been transferred. I'm asking her about the many patients who never received a call, who were never able to be attended to. I'd like to know this. If, in fact, there was a member of the minister's family to whom an air ambulance was not able to respond, would she stand in her place and be as glib about this incident as she is today?
Minister of Health.
Speaker, it is vitally important that all parts of our healthcare system are working to their maximum capability. Orange is making significant progress towards being the very best it can be, Speaker.
The member from Nepean Carleton will withdraw.
Withdrawn. Shane.
Sir.
That is in place. The new legislation that is currently before the House will give us the information we need to be able to measure exactly the kinds of questions the member opposite is asking. I think it's vitally important that all members of this House acknowledge that Bill 50 is an important piece of moving forward with Orange. I do not understand why the member opposite continues to criticize.
Member from Renfrew, come to order.
Be part of the solution.
Thank you. Final supplementary.
What the minister doesn't understand is that this province doesn't need more regulations and regulations. It needs a minister who can hold accountable our air ambulance service. That's what we need. The reality is that in our hearings so far, there are 3 themes that are developing, Speaker. And one of them is that greed led to waste of precious health care dollars at our air ambulance service. The second is that incompetence and mismanagement has put patients at risk. And the third theme is that this government is much more intent on defending itself and diverting attention from itself than it is about getting down to the bottom of fixing what needs to be fixed. And I would suggest to this minister that what she should do now is look carefully at the testimony of Mr. Kidd and others from across this province and admit that she has mishandled this file. What she should be doing now, either get it fixed or step aside and let someone competent deal with the file.
seated, please. Thank you.
Bill 50.
Speaker, of course we're paying very careful attention to all of the people who are testifying before the Orange inquiry, Speaker. I think it's important that we also take advice from other nonpartisan, impartial experts, Speaker. That includes the Auditor General of this province. The Auditor General has acknowledged the significant steps that have been taken. Speaker, his advice is to do what we are doing in Bill 50. I do not understand why the member opposite continues to hide information that he has on this issue. I do not understand why he rejects the advice of the Auditor General. If he wants to be part of the solution, Speaker, then stand up and be part of the solution.
Order.